Hello and welcome to the group room where we're at the 34th annual CTRC-AACR San Antonio Breast Cancer Symposium. Very happy to be joined again this year by Dr. Clifford Hudis, Chief of the Breast Cancer Medicine Service at Memorial Sloan Kettering Cancer Center and Professor of Medicine at Weill-Cornell Medical College in New York City. Hello, Dr. Hudis.
Hello.
A lot of discussion with the advocates has been focused on the issue of brain metastases.
Yes.
And the desire to be able to actually get biopsies of active brain met tissue. Any thoughts on that?
Well, I didn't set you up for this, but Andy Seidman, my colleague, has been running a study now for 2 years where we actually, every time a new patient with brain metastases is found at our institution and who otherwise needs neurosurgery, which is a small number every year, but for various reasons some of them need neurosurgery either because it's their first site of disease and they need a biopsy or because they have a little bit of a crisis, we have a clinical trial where we give them a dose of chemotherapy within 24 hours of the planned operation. We get the biopsy, and the point is we're actually assaying the tumor tissue for penetration of the chemotherapy, because for years everybody's believed in this blood-brain barrier, and at the same time everybody knows that if you give chemo, shrinkage of brain metastases is common.
You have lung mets, you have bone mets, and these are much easier to deal with. And the brain metastases, we don't talk about it as much, but it seems like for the patients this is a critical area that needs attention.
Well, I think we do talk about it. The problem is, and it's actually a simple idea here that's worth understanding. In the case of every other tissue in the body, a metastasis is there, it grows, and you have lots of complications from that. That's true in the brain, but you have two special issues in the brain. The first is it's a contained space. So growth of a mass in the brain displaces normal tissue and has nowhere to go. The liver can get bigger. The lungs can extend against the diaphragm and so forth. But the brain can't move. The skull's fixed. So you have pressure issues from the beginning. The second is every area of the brain has very specific focal functional roles to play. So when you compromise them, you see it in odd ways, right? With weakness or muscle control issues or cognition or what have you. So the brain has two special features. These aren't biological differences, though. So the point is that treatment that works in other places can and should and does work in the brain. The issue is the acuity or the emergency of brain metastases is what's different because of this contained space. And that's really the dilemma. The second thing is, I would not agree that we're not aware of it or we don't talk about it. Brain metastases are a key issue in HER2-positive breast cancer, a little bit less of an issue in triple-negative, and relatively uncommon numerically in ER-positive.
I think the feeling I get from the advocates is that because they're so much harder to treat and effectively deal with, that it's, and I'm not talking about in the clinical community, amongst the patient community, it feels like the area that they're very concerned about, and there's less opportunity for them and less options. And
well, I think the issue is that when it comes to the brain, it sort of strikes at who and what we are. That's the real issue. The flip side, I'll just point out to you, though, is way back in the day when we were first doing bevacizumab trials, there was a concern about bleeding in the brain, and so we were doing routine scans to screen people. Between 15 and 20% of people who have breast cancer have unsuspected brain metastases, and many of them probably live their lives and never find out about it also. So there's little ditzels, if you will, that they don't grow out. So it's probably a more common problem than we realize.
Thank you, Dr. Clifford Hudis, Chief of the Breast Cancer Medicine Service at Memorial Sloan Kettering Cancer Center and Professor of Medicine at Weill-Cornell Medical College in New York City.
Thank you very much.
Thank you very much.